and welcome to acupuncturists and other therapists in England and around the world. So we're going to look at the legislation that might be affecting you in this country and abroad. First aid, some of the things that you need to know. We're going to look at confidentiality and consent, obviously really important if you've got a red flag and you need to breach confidentiality for some reason, or consent to get some, you need to work on some part of the body. We're going to then look at the red flags, what perhaps some of their Western treatment would be, but more importantly how you need to deal with that if it ends up as a first aid emergency in your clinic. And then we'll draw it all to a close at the end. So red flags. In first aid, there's always going to be people who are going to recover. Doesn't matter what you do. There's also going to be those that won't recover, whatever you do. And those that will recover because of what you do. So these last group of patients are the red flag patients. So you acting is going to save their life, it's going to shorten treatment, it's going to get them into treatment earlier. So what does the law and regulation say about it? In every country there's going to be law, regulations, professional associations that are going to be governing what you do, and you need to be fully conversant with these in whichever country you're practicing in. Typically they're going to include health and safety at work. In the UK it's called management health and safety at work. There'll be health and safety in the workplace, health and safety first aid regulations. And usually there'll be a law, then there'll be regulations and guidelines governed by professional associations. When you're in your clinic, you need to have undertaken a risk assessment. And this risk assessment needs to include the workplace, hazards, size of your organisation, etc. Usually, the thing in there is that we're remote and lone workers. We're normally working on our own in a clinic room. We're not normally working in a big multi-bed setting or in a hospital. If we're lucky enough to be doing that, we're still normally one-to-one with patients when we're working at them.